So I have something to ask you. So I hear a lot about acid reflux, especially in bodybuilding and everyday life. What is it? What causes it, especially for people like us who compete? And that's my question to you,
Okay,
Doc.
good question. So acid reflux, essentially, we get a lot of stomach acid. Our stomach makes acid in order to digest our food. Sometimes there's a valve in between our stomach and our esophagus, and that valve kind of regurgitates some of that acidic acid up back into our esophagus. So it can cause some burning. Most common feeling is like a burning in your chest. And some people don't even feel it at all. It's actually normal to have up to an hour a day of some acid reflux. You may not even feel it, but obviously when it becomes a problem is when you feel it, it's not comfortable. Some people, it can even get as severe as they feel like they're having a heart attack. So it can get pretty bad. So what are ways to fix it? A lot of lifestyle things. So make sure right after you're eating that you stay upright for at least an hour. So a lot of times when you lay flat, that is what causes that stomach acid to come back up into the esophagus. So make sure you're standing upright for at least an hour after you eat. Certain foods, so watch things like fattier foods, higher acidic foods, so like tomatoes, garlic, onions, things like that can certainly cause more acid reflux. And stress. Stress plays a huge role on the body.
There it is,
so
stress.
Stress can cause it as well.
So let me ask you this too. So as far as competitors and bodybuilders, I know for sure, I know plenty of bodybuilders who feel this way when they're on TREN.
Yeah, I don't think it's fully understood how or why this happens, but it is very common. So a lot of competitors, a lot of guys taking TREN, they're already in a prep setting, they're already, their body's at a heightened stress, mentally, physically, and then you add TREN on top of that, and it can get really bad for some guys.
Yeah, I heard that.
So how does that person fix it? Because at that point they're eating clean.
Right.
So how does that person fix it?
So at that
Good luck with
point,
that.
I would say antacids can help. So like Tums, things like that, if you're having the active symptoms. Other medications, such as, they're called H2 blockers and PPIs, proton pump inhibitors. So examples of those would be, and you can get them over the counter, or your doctor can prescribe them, but most people know them as Prilosec or omeprazole. You can get them over the counter in the pharmacy section, so those could help as well. But ultimately, the lifestyle factors we're gonna wanna change those. So a lot of those, you're right, with like a prep setting, if you're taking TREN, you can't really take that away unless, maybe go down on your dose a little bit. But some of those medications can help get you over the hump. Make sure, again, you're not lying flat right after meals. And then limiting tobacco and alcohol use. Because those actually can exacerbate acid reflux.
But you made the main thing too. You gotta keep your stress. Try to do as much as you can. Keep your stress levels low.
Yeah, stress is a big one, and it's hard. It's not like a super tangible thing, but stress management is huge for anyone, but especially if you're in a prep setting, because stress is it's going to cause more inflammation. It's going to cause a lot of downstream effects in your body that you don't want.
Yeah.
So I have a back-to-back question. What about a 15-minute walk after a meal?
Yes, that's actually
standing up when I eat.
I don't think you necessarily need to stand up, just as long as you're sitting upright.
Yeah.
You just don't want to lie flat right after eating. Right. But yes, that's another thing I recommend. Like a lot of patients I see in the hospital, I'll tell them, even taking a 15-minute walk right after you eat can help. And it actually helps improve blood sugar levels too. Studies have shown that just simple walks after you eat.
So for those people that are work that are eating and then crashing, will me taking a eat and then walk, will that help me get over that midday hump?
I think it certainly could, especially if you're walking outside, you're getting sunlight. I think all of that plays a role, and even just being more active, being more proactive in your own health is going to make anyone feel better.
Right. So. Guys, appreciate the questions. Keep them coming. Talk to Miss Storm here, nurse practitioner. Much love.